today's episode of Reading from the Bible, and I've covered this topic many times. Question is often asked in cases of a patient walking in as an emergency. They have a hot tooth, irreversible pulpitis. You diagnose the tooth as irreversible pulpitis, but you don't have time. What are you doing in these situations, in these cases? And I always say, do a pulpectomy. Or if you don't have time to do a pulpectomy, don't put a file in the canal unless you commit yourself to do a pulpectomy. Okay, you can do a pulpotomy, but that could relieve some of the patient's symptoms, but not all. But the best ideal thing to do would be to do a complete pulpectomy, and here's why. And again, I've covered this case many times. I've read this book maybe 10 times from cover to cover, so I know what's going on. And that, when I give you guys my recommendation, my advice is based on science. It's not based on my anecdotal experience. So here we go. Irreversible pulpitis. Emergency management for painful irreversible pulpitis involves initiating root canal treatment to alleviate the pain. Okay. Irreversible pulpitis can be predictably managed by complete removal of the pulp and total and cleaning shaping of the root canal system. In multi-rooted teeth, a pulpotomy, that is the removal of the coronal pulp, or partial pulpectomy, that is the removal of the pulp from the widest canal, have been advocated for emergency treatment of irreversible pulpitis. However, because it is impossible to detect clinically the apical extent of the inflamed pulp, and therefore provide predictable pain relief, it is important to perform a pulpectomy at the emergency visit. Good morning. A file should not be introduced into any canal unless a pulpectomy is anticipated. Often inflamed vital pulp tissue that is lacerated with endodontic files will result in increased discomfort. So patient comes into your office with a lot of pain. You don't do a full pulpectomy. You just put a file in the canals. Patient leaves with more. So don't put a file in a canal, into any canal, unless a pulpectomy. You commit yourself to a full pulpectomy. Okay? So often inflamed vital pulp tissue that is lacerated with endodontic files will result in increased discomfort because the pulp has become inflamed, shredded, and traumatized. Pain symptoms can persist or worsen if inflamed pulp remains in the root canals, because the inflammatory process will extend into the periodical tissues. Okay? So, don't put a file into a canal unless you do a full pulpectomy. Now check this out. Post-operative pain and the long-term prognosis after single visit endodontics is similar to root canal treatment completed in multiple visits. So, to those who say, patient comes in and they're in a lot of pain, it's recommended that we do it in multiple visits. Do the root canal multiple visits because of the fact that the patient comes in with pain? No, that's not the case. So, no contraindication to single visit endodontic treatment. Post-operative pain and the long-term prognosis after single visit endodontic is similar to multiple visits. Because temporary restorations eventually leak, obturation in one visit eliminates the possibility of inter-appointment bacterial contamination of the root canal system. Okay, so if you run out of time, if you don't have time, yes. However, time constraints at the emergency visit often make the single visit treatment option difficult. So if you don't have time, then you can do it in 2 visits. But ideally, you want to do obturate in 1 appointment. If I told you that this book alone probably has saved more lives than the Torah, the Bible, and the Quran combined. All right, let's read. Okay, so today I want to talk to you about the periapical disease. All right, this is how we learned it. I know the nomenclature has changed, but this is what I'm comfortable with. I still use this nomenclature, all right? So periapical disease, we have acute apical periodontitis, acute periradicular abscess or acute apical abscess. We have chronic apical periodontitis, we have phoenix abscess, and we have periapical osteosclerosis. All right. So acute apical periodontitis, just to simplify, is when you percuss a tooth and it's tender to percussion. That's what this means. This is the periapical status of the tooth, not the pulpal status of the tooth. It could be related to the pulpal status of the tooth, but sometimes it's not. Sometimes a healthy pulp tissue, a tooth with a healthy pulp tissue can exhibit acute apical periodontitis. Why? Well, acute apical periodontitis is painful inflammation around the apex of the tooth. This condition can be the result of an extension of pulpal inflammation. So it could be the result of pulpal inflammation, extension of it into the periapical tissue. It could be mechanical or chemical trauma by endodontic instruments or materials, or occlusal trauma caused by hyperocclusion or bruxism. Because acute apical periodontitis may occur around vital and non-vital teeth, conducting a thermal pulp test is the only way to confirm the need for endodontic treatment. As always, the need for endodontic treatment must be determined by pulpal status alone. Just because a tooth is tender to percussion doesn't mean it'll need a root canal. That's what it means.